If you have low back pain and you've tried sticking a foam roller under it, you've tried stabbing it with a Theracane, and you've even stuck a good old-fashioned lacrosse ball underneath it and it still hasn't worked. I'm Dr. Davis and I'm going to show you a better way to perform self-myofascial release, which is just a self-massage to help relax those muscles and help you feel better if you've got low back pain. Quick note though, step into my office. Myofascial release is what we all call it, but that's not really what's happening. You can't release myofascia. It's not really how it works. You're not ripping apart scar tissue. That's not how it works. It would be more accurate to say myofascial desensitization or myofascial relaxation massage. Now, the basic premise here is we're going to take a lacrosse ball or a tennis ball or a self-massage ball and basically stick it right here. Now, this is intuitive. It's wherever you feel it. So if you feel it lower down by the SI joints, great. If you feel it more in the QL region, great. But if you've ever been to a chiropractor or a physical therapist or some kind of massage therapist and they've done a pin and stretch massage, this is how we're going to get you to do to yourself what your therapist is doing to you so that you can get the same benefit at home for free. Also, another quick note, step into my office. You cannot pin and stretch your muscles. The reason being because the interface between your skin and the underlying fascia is frictionless. So it's the reason why, well, here, look at my tattoo. So I can pin it down and I can move the skin all around and the underlying muscle is not being dragged around with it. That's because the interface between my skin and the underlying muscle is frictionless. So you cannot pin and stretch muscles. That's impossible. But what you can do is compress and then slide the muscle back and forth underneath that point of compression, and it provides a unique or novel sensation and stimulus to the muscles compared with compression alone. Okay, so what you're gonna do is take the ball and find the spot that hurts. As long as you're not touching bone, it's fine. So just feel around, find for the muscles that hurt. Where does it hurt the most? And there might be many locations, that's fine. You can hit multiple locations and that's fine. So you're gonna lay down. Again, find that spot and put the ball where it hurts. This might be enough for some people, but I bet a lot of you have tried this already and it's already, it's not helping, it's not enough. Well, then what you're gonna do, where we start the pin and stretch, which again is not a real thing, but the more like pin and glide, or compress and glide. That's more what it really is. Compress and glide therapy is what we should call it. So before we start that, what we're gonna do is chill and make sure you can breathe. If you can't breathe deeply here, then it's too much. It's too much pressure, okay? So wait until you can breathe peacefully and actually relax. The point of this is to relax your muscles. So let them do their thing. But if you feel like you want more stimulation out of this, then while the ball is underneath some of those tough muscles or tender muscles, we can draw the knee into the chest and breathe. So I'm gonna inhale, straighten my leg. Exhale, knee to the chest. Inhale, straighten the knee. And then exhale, draw the knee to the chest. Now, sometimes your pain might be a little higher up. If so, okay, move the ball to where it's a little higher up, but maybe you don't feel like the knee is really getting that spot. You can hold the knee with the opposite arm and then reach your arm overhead, breathe in. And this is probably more your latissimus that is painful. If this really gets the spot, then it's probably more your lat. So we inhale overhead and exhale slowly as you reach back down by your hip. So movement of the knee back and forth or movement of the arm or both could be useful as you pin and compress or compress and glide. Usually with patients, I recommend doing about 30 seconds, maybe a minute per spot, especially if you have multiple spots that are pretty tender. So spend about a minute there, 30 seconds, at least 30 seconds, or just take 5 really slow breaths as you move your leg or arm. Remember, you don't have to move your leg or arm. You could just put the ball there and just focus on the breathing without movement. And another reminder, please don't put the ball in a place where you feel bones. So don't compress over bone. You're just going to end up with a bruise and it's not going to help anything. If you have questions, leave them in the comments. Thank you for watching, and remember that motion is lotion. Movement is medicine. I'll see you in another video.